Alrighty, jumping back into this, we are talking about the skin lesions, and this is how we diagnose to tell whether or not there's a reason to actually do a biopsy on skin lesions. Okay, so it's our ABCDEs. So asymmetry, border, color, diameter, and elevation. Okay, so this is the normal side over here. So if you look at the normal mole, for example, asymmetry. Okay, asymmetry means that you can take something and cut right through the center of it, and is one side pretty much a mirror image of the other side. That's whether or not it's symmetrical. Okay, asymmetry means if you cut right through the center of it, that this side is not the same as that side if you took it and looked at it in a mirror. You see how they're completely different on each of those sides. So asymmetry is our first thing to look at with skin lesions to decide whether they might be cancerous or not. Okay. Second thing is border. If you look at this border on here, it's pretty even. Okay. It's certainly not round, but it doesn't have to be round. It just has to be continuous, not a whole bunch of jagged edges. Like if you look at this border here, it's kind of all over the place and maybe a little lighter. Anyway, it's all over. See that border? It's definitely not any kind of a smooth thing. So the border is ragged, irregular. All right. The next thing's color. So as you see this is all one color, as are the other normal looking moles. Okay, they're different colors, but they're all one color anyway. As opposed to this one right here, you can see off on the right here, it is a lighter color than the same mole on the left. When colors start to change like that, that should be a pretty big red flag that it might be cancerous. Okay, and definitely would warrant a biopsy on that. The D diameter, okay, this isn't really showing you much, but what it means is if it's larger than a pencil's eraser. Okay, so if it's larger than a pencil's eraser, really big, then you need to look at it and think about the need to biopsy that as a cancerous mole. And the last one that I don't have written on here is elevation, but if you think about it, if a mole is high, elevated, coming out of the skin, there's also a possibility it is going low, and down in there is your bloodstream. So clearly, if it's elevated up, it could be elevating down, and if it is elevating down and gets your bloodstream, now we just ran into something that can get in your blood and certainly would be a problem. Switching gears a little bit, I mean, we're still obviously on skin, but now we're talking about tinea. Okay, tinea it's a group of what we call different, they're fungi, so they're fungal skin infections, but we have them, depending on where they are, we kind of change the name. Alright, so for example, tinea corporis, tinea pedis, tinea cruris. Okay, tinea, they're all tinea, they're all the fungus, but now we're looking at where they are. So the one corporis, as in on the body, or the corpse, right? They kind of come from the same kind of word, or the body. Okay, that's the one we call ringworm. Now if you look up here, that's the ringworm. Obviously is not a worm, it is a fungus that looks kind of like a ring, and it goes around in a circle like that. Looks kind of familiar if you look at that, a little bit familiar to that erythema marginatum that we saw way back with the strep infection, that rheumatic fever. Okay, except that the rheumatic fever didn't have this inner one also. It kind of was only on the outside and got lighter on the inside. Okay, athlete's foot, everybody's seen some of that, right? Athlete's foot, tinea pedis, as in pedal, as in the foot. Yes. Okay, and jock itch, which is tinea cruris, or in the crural region, or crotch. Okay, now obviously, or not obviously I guess, but the ways that you can get this fungal skin infection is it's a fungus, so you can touch it, transfer it from one person to the other. Probably most common are wet floors. You can even get them from pets. Obviously, you're probably not getting like jock itch and that sort of thing through a wet floor or something like that. But humidity and coming in contact with something with a fungus on it can cause that. All right. What's tinea do? Well, it itches and it kind of burns and, you know, red, as we can see up there. But we'll see some other things on here. There's some other slides, and show you more of these in a second here. Okay, it is a fungus. It can be tested clinically to find out, you know, if it's a fungus, you go to do scraping of it, or depending if it even went in your blood, you can find it there too. All right, this is not the best picture in the world, I would say, but if you look pretty close, you can see this entire area on the inside of that is all red and has little lesions there. Okay, you'd have to look pretty close to actually see the, you know, what it looks like ringworm portion of it. Okay, a little closer here, you can see this, you know, where it's the edges of the outside of it being very red, and you can see where it's kind of has a little texture to it, little bubbly kind of thing. Okay, this is in the scalp, obviously, and you see these little circular, scaly, inflamed patches in the scalp, and so we're kind of looking at maybe this little area right in here that's inflamed and kind of scaly, but also if you look up here, it's like he lost a bunch of hair in that area from leftover, maybe thinned out here too. So you can see these different areas in here where the hair is definitely thinned out in those areas that don't look like they're as thin as other areas in the head. Okay, but you can cause, you know, scarring, and permanent hair loss can be seen if this is, you know, bad enough and it lasts long enough. Okay, yet another one. This is obviously the foot, so tinea pedis, or athlete's foot, as it's called. This is a little another one. Okay, athlete's foot, all over that toe. It's pretty much everywhere. Okay. Sometimes tinea, the fungal infection, can present with vesicles or bullae, or bullous tinea as they call it. Okay, so it's just you still got the fungal infection, but now it has a big fluid inside of it. Let's move on to herpes. Okay, herpes is a really big family of diseases. Okay, we have a lot of things that we talk about in pathology that are from the herpes family. Okay, including, you know, the Epstein-Barr virus and cytomegalovirus, and of course our chickenpox and shingles that we'll get to in a second here. Start out in order here. Herpes simplex virus 1. Okay, that's basically what? A cold sore. Okay, the herpes sore, S-O-R-E. So the cold sore and herpes simplex virus 1, that's pretty common, right? Most people have had a cold sore in their life. That's just a little sore on their lip, and it goes away, or the corner of their mouth or something like that. It goes away, not a big deal. On the other hand, herpes simplex 2 is what is the sexually transmitted disease, and this is the one that does not go away, right? Herpes simplex 2, the gift that keeps on giving, and it never goes away. It's always infective, even when there's not an outbreak of it, and we'll look at that, I think, in a second here. But for now, let's kind of keep moving. The herpes zoster, I think my paragraphs are probably a little messed up here. Probably shove that way because it's not part of herpes simplex 2, obviously. But herpes zoster, okay, herpes zoster is what we call chickenpox virus. Okay, so the chickenpox virus, how this kind of works is from the herpes family itself, there are a lot of different viruses, like I said, that infect humans. Well, if you take this one, for example, and you have the zoster or the varicella family. Okay, the varicella family will break down into the zoster, which is chickenpox. And this chickenpox, after you get it and you get rid of it, it goes to the back of the spinal cord. So if this is your spinal cord and and this is the front up here, and this is the back of the spinal cord. In these dorsal root ganglia, back in the sensory part of the spinal cord, in the back of the spinal cord, the herpes zoster or chickenpox virus will actually go and hide in there, and it'll hide in these areas back in here for many, many, many years until the patient might become immunocompromised. Okay, if the patient becomes immunocompromised years later, then that varicella zoster virus that was hiding out there will follow these nerves, the sensory again, follow the sensory nerves all the way back up, and they'll show up in the skin wherever these nerves were innervating for sensory in the skin, and then it's what we call shingles. Okay, if that makes sense, hopefully. So zoster, varicella zoster, will actually turn into shingles much, much later after it's become immunocompromised. All right, and that's what we call it. The signs and symptoms, where are we at? We are back into not shingles, clearly, because that is definitely not asymptomatic. We're back to our STD. So again, my slide is apparently out of order here, but we're back to herpes simplex 2. Signs and symptoms. When there's not an outbreak, there's no signs or symptoms. There's no itching, no pain, no burning, no trouble urinating, no ulcers, vesicles. Any of that stuff is not there when there's not an outbreak. Okay, but obviously when there is an outbreak, that's what you get is the herpes sores. Okay. When there's an outbreak, you kind of feel like you have the flu because it is a virus. Maybe not the same virus, but it's a virus, and you kind of feel all icky. Now, one major problem with herpes is that it can also go to the eye, and it can cause you to be blind. Okay, so that's obviously pretty serious. And wow, these really kind of are out of order. But that sore that we were talking about, it usually heals within the first 3 weeks and then kind of goes away. Okay. Problem obviously is it is sexually transmitted. Once you get it, you never get rid of it. You have it forever. Even if you're not have an outbreak, you can still transmit it to somebody else, and it's obviously a problem. Okay, so you do want to rule out other sexually transmitted diseases when you're talking about herpes simplex virus number 2, because obviously the same reason you got herpes simplex virus 2, you could get other STDs. Okay, this one hopefully is just your basic cold sore, although when you have 2 like that, it's not necessarily a great sign that it is just a typical number 1. It could be number 2 there also. Kind of what I was talking about is the lesions or little bubbles, the sores that come with herpes, and they can be obviously either on the shaft of the penis or any around the outside of the female parts there. All right. Now we're on shingles again. So now we're back to the shingles, and this area apparently is where whatever nerve that virus was on back in that dorsal root ganglia of the spinal cord has decided to innervate this part of the skin. So this is where the shingles pops up again when it becomes manifested as shingles instead of a dormant chickenpox virus. Okay, Candida. So Candida is yeast, so we're still talking about fungus, or a kind of fungus, I guess, is a yeast. And this is obviously not a little kid, this is an adult. You have an adult with that kind of serious case of Candida thrush in their mouth, then that's probably an immunocompromised person. Okay, but yeast in and of itself is actually not that uncommon. Healthy women have yeast infections all the time in the uterus. Why? Well, there's a lot of reasons for that. Okay, even something like antibiotics can cause a yeast infection in a female. Obesity, just because of the, kind of for the same reason as diabetes, where your mucous membranes are more sugary, you have a decreased immune system, obesity and diabetes kind of fit right in there. Anyway, hormonal. Okay, so you do actually see with birth control pills sometimes they're supplementing with estrogen, which is also related to birth control pills, but hormones can throw off the normal flora down there and cause a yeast infection to spread. And of course, anything that decreases your immune system can cause any kind of opportunistic infection, and yeast infections or Candida are one of those things. So AIDS, obviously, that would be a pretty typical thing. I'm not saying that this person up here has AIDS, but it's certainly possible that that person up there has some kind of serious immune complex or immune compromised. I mean, hey, all right, Candida, as in gynecological Candida, as in female Candida. It can be asymptomatic to a certain extent. Eventually, it's going to start itching, okay, and even discharging this cottage cheese sort of discharge. If you look at that, I mean, we're talking the tongue here instead of vagina, obviously, but you can see where that would be noticed. Okay, dyspareunia. I think that's a hyperlink on the regular PowerPoint. If you wanted to hyperlink on that, but and get the definition, I think is the only thing that's a hyperlink to. But that just means painful sexual intercourse. It's probably a new word for a lot of people, but dys is either pain or definitely unusual. So dyspareunia is painful sexual intercourse, and also hurts to urinate. So dysuria. How do we test? So this kind of buzzword kind of stuff for Candida is that one, you can usually test it with or diagnose it without even bothering with tests because of what it looks like. And when you do test, though, the KOH prep or potassium hydroxide test, when you prep the slide for that, after you grab it and culture it, and you throw it shows up as pseudohyphae. Okay. It has this very specific branching pattern, and I'm not even sure I could really draw it, but it branches out. I don't know. You'd have to look at it. But it has a very specific pseudohyphae branching pattern on KOH prep, and that's kind of a buzzword for that. It seems to come up. Okay. If something, any kind of fungus or yeast gets in the body, then these azoles, drugs that have the word azole in it, and there are plenty of them, will treat it. Okay, but this is if it's gone bloodstream and that gone into the bloodstream, then these medicines that you can take that will get rid of it in the bloodstream, and of course there are topical medications also to get rid of it. Okay, what they do, I'm not sure that we go into that this much in this class, but ergosterol is a hormone that you really need for the cell wall of a yeast to grow, and you block the manufacture of that with these azole drugs, and it can't replicate anymore, so it cuts it off. Okay, there's a few pictures of the nasty thrush infection on the left there. You're looking at the back of the throat here, all over the back of the back of the throat, pharyngeal tonsils, and got this picture over here. This picture over here that it doesn't look that much like a yeast infection, but some kind of fungus going on there. Anyway, this is the baby, right? The baby with the thrush. This is a very bad case of thrush in a baby, but it's the Candida thrush is what we call it. Anyway, very bad case, but it's not that uncommon to have thrush for babies, just not typically that bad. Okay, so be very careful about keeping babies' environments sterile so that they don't end up with thrush. And I think this is probably a decent place to stop, and we'll get into trichomonas on the next video.